had some surgery on my jaw at another institution, and because of that surgery, they had to take a graft from my hip and implant that into my jaw. Post-operatively, I suffered a hip fracture due to that amount of graft being taken from my hip. I had the surgery done at another facility, and I asked to have my care for my hip fracture done here at PCI here in Cedar Rapids. I'm a nurse, but my background is not in orthopedics. So even though I am a nurse, I was still very confused. I was still very scared. I've never had a broken bone in my life. She sat down next to me. The first thing she said to me was, "Hello, I'm Dr. Coester." She put her hand on my hand and she said, "We're gonna get through this." And I just took a deep breath and I said, "Okay."
It was really tough for her to have to go through that on top of everything she was going through for the original surgery. So she just needed somebody to listen to her and to take it seriously and say, hey, yeah, there's a problem going on here and we need to address it.
You can just tell right away when Dr. Coester sat down and explained who she was and how she was going to care for me. I felt at ease right away. Where I had my jaw surgery done and had those experiences, I always felt, okay, there's a million questions I need to be asking. I don't feel like things are complete. I would see multiple physicians. Each appointment that I had, I would see a different physician. I felt like I was telling my story every time I went there, which got a little frustrating because I felt like, okay, this person doesn't know me. They don't know what happened. They don't know my story. And I never felt that way when I was under Dr. Coester's care. I always just felt like the ball was going in the right direction. I was seeing the same person every time. She knew my story. I didn't have to tell my story again every time. We were picking up where we left off the last time I was there.
We try really hard at PCI to promote that culture of being patient-focused. We're a big organization with a lot of specialists, but we're also a small organization. And when a patient comes in to see us, we can really maintain that continuity of care. Whether it's simply each time a patient comes in to clinic, we remember them from the last time they were with us. So the patient really feels like people understand what's going on with them and can provide for their care and are focused on them.
I was actually scheduled to see Dr. Coester. I got in the waiting room. They had me get my x-rays right away, which was just right down the hall. So as I'm waiting to see her, I'm getting my x-ray, so there's basically no waiting time because I'm getting something done while I'm waiting. And then I'm in the waiting room to see her and she's looking at my x-rays. So basically when I'm in the office to see her, she has answers for me right away. You're sitting down talking to her for the first time and she can tell me, look, this isn't as bad as you think. It's gonna be okay. I mean, that's very reassuring. My experience here has been wonderful. I don't have one bad thing to say. I just had this great love for PCI. They know what they're doing and they get things done properly and they really care about your health. You know, they follow up with you when you're discharged. If they didn't care, they wouldn't do that. They really care about what's going on with you in your life.